Ascension St. Thomas Midtown Neonatal Intensive Care Unit is special care for your baby's needs. Behind these doors is a 52-bed unit that cares for babies that were born early or term infants that require a higher level of support. We recognize that life in the NICU is overwhelming and confusing. Please know that our entire team of professionals are here to support you during this difficult time. While in the NICU, you will come in contact with our entire team of professionals. This team consists of neonatologists and neonatal nurse practitioners. They together will oversee the medical care that your baby requires. Our neonatologists will keep you updated as necessary on your baby's status. If you would like an update by phone, please let your bedside nurse know, and we will have a neonatologist contact you by phone. Our parent advocate is here to support and educate the family while in the NICU, and as time gets closer, help you to navigate the discharge process. Your baby is developing every single day. Neonatal therapists are part of the NICU team and help nurture your baby and growing family. They will help your baby gain the skills they typically develop inside the womb. Lactation support starts immediately after delivery of your baby. Our lactation experts work exclusively with NICU mothers to help you on your breastfeeding journey. Our case management team is here to answer any questions that you have about insurance, finances, or home support. Our chaplain is here to provide spiritual and emotional support for your family while in the NICU. Additionally, they can bless, pray, or baptize your baby if you would like. Our clerical associate is the first person you will see when you enter the NICU. She is here to help you with the check-in process, answer any specific questions you may have about visitation, scrubbing in, or cameras. There is a limit of 2 people per bed space in the unit at a time. If you are visiting as a family unit, this visit is limited to once daily for 20 minutes. This is defined as the 2 band holders and siblings of the baby. And of course, this is only during non-restricted visitation times. Our bedside nurses and respiratory therapists work together as a team to take care of your baby. They provide hands-on care, breathing support, education, and are there to answer any questions or concerns that may come up daily. Safety expectations while in the NICU by family and visitors includes low voices. No loud voices, yelling, or screaming is permitted while in the NICU. Appropriate language, no vaping or cigarette smoking, no sleeping, no food in the unit. However, drinks are permitted, but they must have a lid. No persons visiting the NICU should be under the influence of alcohol or drugs. If this behavior is suspected, you will be asked to leave by the nursing staff or security. The safety of our patients, families, and staff are of the utmost importance. If any of these expectations are not followed, we will ask you to leave the unit. We realize that having a baby in the NICU isn't planned. So because of their special needs, we ask that you observe the following guidelines. Please ring the doorbell, show your ID band, or your ID and enter. Please stay home if you are sick. We realize that this is difficult. However, illnesses that are not too bad for older children and adults may result in bad outcomes for NICU babies. Scrub for 2 minutes every time you enter the NICU. After scrubbing, please use alcohol foam on your hands. Take off all jewelry and watches, Fitbits, etc. These items hold germs, and our babies cannot tolerate germs. We do not have public restrooms inside the NICU. Bathrooms are located outside of the unit for safety purposes. For your baby's safety, a copy of the band holder's picture ID will be made at the front desk for the unit ID book. Always make sure to check in at the front desk to receive your sticker. The sticker shows that your ID has been checked. Did you know that your cell phone carries a lot of germs? Cell phones should be wiped down with alcohol pads. These pads are available at the sink or at your baby's bedside, so please wipe your phone down prior to touching your baby. Also, as your baby improves, we will move them to another area of the unit. This communication can be found at the front desk next to the sign-in sheet. Once your baby is admitted to the NICU and all tucked in, one of our bedside nurses will go over visitation guidelines and admission paperwork with you. We have 2 types of visitation, restrictive and non-restrictive. Restrictive is just that. It is strict, and this is due to infection control. Our clerical associate will let you know which visitation we are observing while your baby is in the NICU. Restrictive is 2 band holders and 4 pass holders. That's it. Choose very wisely because these pass holders cannot be changed out. Non-restrictive is less strict. It includes 2 band holders, 4 pass holders. Siblings under 12 may come in once a day for 20 minutes, or as a family unit once a day for 20 minutes, and other visitors as well. As always, 2 people are allowed in the unit and at the bedside at a time. Do not come in if you are sick, and only band holders may stay during change of shift report, which is 6 to 7:30 a.m. and p.m. A copy of these guidelines are posted on the outside of the unit, and you will receive a copy with your paperwork. Other admission paperwork includes various consents about labs and immunizations. There is also a 4-digit HIPAA code that we will give you, and you must have this code to get info on your baby via phone. We realize that this isn't what you wanted, but know that your baby is safe and you can start bonding. Talk to your bedside nurse about care times. This is when we touch baby. Baby's senses are very sensitive. They really want a still, firm hand to make them feel secure, and we call this a hug hold or a containment hold. Gently stroking your infant is hard for them to process, and it can be uncomfortable for them and stressful. Your baby's sleep times are very important. This is when their brain is growing and building connections while they are sleeping. So again, please talk to your bedside nurse about care times because these are the times that you can bond with your baby. The cameras are a service we are happy to provide while your baby is in the NICU. Please know that we will turn the cameras off while we are providing care and turn them back on when we are finished. If you have an issue with the camera, please call the number provided on the paperwork given on admission. The whiteboard at each bed space is a communication board for the parents. Hands-on care times are noted at the upper right-hand corner. Please make sure, if you would like to be there for care times, that you arrive 30 minutes before. Our main goal is for you to hold your baby skin to skin. Skin to skin, or kangaroo care, is a special way of holding your baby. It is therapeutic and provides an immense amount of benefits, especially for a NICU baby. You can start as soon as your baby is stable. In the NICU, this is unique for each baby. We don't base it on age or weight, but instead on your baby's condition. Your baby's respiratory support, IV lines, heart, breathing, oxygen support are all considered before we let the baby do skin to skin. Kangaroo care is only beneficial when done safely, so ask your nurse when your baby will be ready. Be sure to use the bathroom and pump before you start. Skin to skin should be performed for a minimum of 60 minutes. Babies' sleep cycles are 60 to 90 minutes, and we want them to get at least one good sleep cycle while kangarooing. Because your baby's senses are very sensitive, we ask that you refrain from smoking, strong perfumes or lotions, and please shower and put on clean clothes before coming to the hospital to perform skin to skin. Once again, skin to skin is therapeutic. It is a bonding time, a quiet time. Please refrain from talking on your phone loudly during skin to skin. From the entire NICU team, thank you for letting us take care of your family.